My name is Dr. Indu Khosla and I am a pediatrician with special interest in pediatric lung diseases. Today, I am going to speak to you about a variety of topics which concern your little children in everyday to-day life. This, I hope, will help you decide how to handle basic issues at home and understand when your child is really sick and needs medical attention. After 9 months of waiting, when the baby, the bundle of joy, finally arrives, the parents are delighted, but they are also apprehensive, curious, inquisitive, and probably a little bit scared. Today, my dear patients, I am going to talk to you about how you must take care of your newborn, also some do's, don'ts, and some things which are normal about newborns which you must be aware of. I'm sure today most of you live in unit families, but there are so many advisors. There may be a neighbor, there may be a malish wali who may come up with some ingenious ideas on how to take care of the newborn. But let me here guide you and hold your hand and tell you how you should take care of newborn. When the baby is first born, it looks rather little queer, coated with little bloody fluid. It may have a sticky discharge all over it, which is called the vernix, which can be washed away with plain water. The baby tends to lie in a curled position with his hands and legs closer to the body. This is because for the 9 months that it is in the mother's womb, the child is lying in that position. It takes the child a little bit to straighten out, and this is a very normal phenomena. If you look at the color of the baby looks quite pink, but the hands, the feet, and sometimes an area around the lips might appear a little blue, and this is normal. The baby should be kept warm, and when you keep the baby warm, the color definitely stays pink. The head of the baby looks much larger than the rest of the body. This is so designed because this enables the baby to be delivered, making way for the rest of the body. There are some soft spots on the head of the baby, and this is to allow the bones on the skull to grow. Once the head is fully grown, these soft spots disappear. The chest of the baby may show a little breast enlargement, and at times there may be a little milky discharge which may come out from the nipple of the baby. There is nothing to worry about this, and it is mandatory that nobody squeezes out the breast to remove this milk, because this can give rise to infection in the breast of the baby. This milk which comes out from the nipples of the baby is because of the influence of maternal hormones on the baby. The abdomen or the stomach looks large, and you have the cord which is severed or cut when the baby is born. There is no need for any exhaustive measures or any measures required to take care of the cord as long as it is kept dry. Most babies today are born in reasonably aseptic precautions in big hospitals, so generally the cord stays healthy. But if you notice a foul smell, or if there is redness around the cord, or it is painful to the child when you touch, that's the time you need to seek medical attention. The genitals of the baby may look puffy, and this may be due to the process of the delivery. And again, this is not of any concern. A whitish discharge coming out of a vagina of a girl child, which at times may have a little blood tinge in it, is again the effect of maternal hormones and does not require any active treatment.